A lot of talk about the origins of COVID-19, natural emergence or the lab escape hypotheses. Which is it? Is there a history of viruses escaping from labs with high containment? What is it? What will it take, I guess, for the scientific community to get to the bottom of this? Let's bring in Professor Adrian Puren, who is the acting executive director of the National Institute for Communicable Diseases, NICD, to discuss some of these issues with us on the agenda this morning. Professor, always a pleasure having you on the program. Welcome.
Good morning, and thank you, Rain, for the opportunity, and good morning to your viewers as well.
So I want to start off with something that we picked up from the NICD. Let's put up a graphic, and so it will be better illustrated for the viewers. Let's look at the laboratory-confirmed COVID-19 among children and adolescents. According to the NICD, as of the 1st of May 2021, individuals aged 19 years or younger made up 9.4% of laboratory-confirmed COVID-19 cases and 3.8% of all COVID-19 associated admissions. Now, there were over 148,000, I think it is, 148,000. Correct. New laboratory confirmed COVID-19 cases aged 19 years or younger during the surveillance period. Professor, put this into context for us. What does this tell us about COVID-19 among children and adolescents?
Yes, so COVID infections are occurring in children. And again, I think we need to, if you like, segment that based on specific age groups, let's say under 10 and above 10, because I think the behavior or the transmissions are really different in those two categories. Whereas I think in the above 10 age category to that of 19, sometimes approaches that with regard to adults. However, I think the overall picture is that compared to influenza, COVID is not as markedly significant to the extent that it is in the older age category. So again, if you look at the recent age distribution, you'll certainly see above the age of 19 and above, there are marked and significant peaks of infections in different age categories, yes.
Look, there's been a number of issues with regards to COVID-19. No doubt you keeping a close eye, or was keeping a close eye on the French president's state visit, Emmanuel Macron, to South Africa. He's raising some interesting issues around COVAX, isn't it? For the benefit of the audience, COVAX is this global alliance aimed at providing innovative and equitable access to COVID-19 vaccines. And he said that he had a personal problem with COVAX because he says, it's very hard to say how much goes where and when. And he said that they are accumulating these commitments, but for when and where, he does not know. Fair point?
I suppose, yes, it is a complex area, as you know, even across specific countries. I think we don't really know what the distributions are. We don't know what the waiting periods are, the extent of manufacturing that is currently occurring. We've seen the problems in the United States about manufacture, and of course now in India, there's also a problem around the scale of the pandemic in India and the effect that will have on vaccines. And there are other groupings within, for example, Africa as well. There's the CDC, Africa CDC as well, that's also really committed to vaccine distribution. So
right.
It is a complex area, and that certainly affects how we will see the vaccine rollout in South Africa as well.
So the French president proposed that they tasked the CDC Africa to outline the goals, as he put it. For example, our goal is to vaccinate 60% of people by mid-2020 and 40% by the end of the year. It needs this number of doses per country, and in front of that, he says, they will put the commitments, the doses and the financing. I would have assumed that this was being done already, but evidently not. Do you see things improving drastically if this is done this way?
I think it will certainly contribute. I think we have ideas around what the levels are in terms of so-called herd immunity that we need to achieve. But I think it's really understanding how to distribute that, because it really, for at least South Africa, our focus is really going to be around the adult population and what numbers we need to achieve there. Again, it's also what we intend to achieve. I know in the earlier days, we were really saying we want herd immunity at 67%, and therefore the numbers are Y. However, I think a topic I'm sure we may touch on is the fact that we may not reach those particular targets, either based on the fact that we may not receive vaccines in time to achieve that level of coverage, but also around the fact that there may well be, for example, vaccine hesitancy and all those particular features that may affect us. So these are key areas that we really need to work through to achieve the numbers that we require.
Let's talk about immunity, and I want to talk about in particular the Pfizer vaccine currently being administered here in South Africa. Earlier this month, I heard that Health Minister Dr. Zweli Mkhize said that they might want to delay the second dose of the Pfizer vaccine by up to 3 months. He said that they want to, I guess, reach as many people as possible and then build up this immunity, because apparently there's evidence coming from the UK that has shown that there's better immunity developing if someone gets a second dose after 3 months than after, let's say, 3 weeks. Explain the science here, Prof.
Yes, so the different vaccine designs. So as you know, the Johnson & Johnson vaccine relies on a single dose. I mean, in other words, the efficacy of that particular vaccine was really achieved after a single dose. Whereas, for example, the Pfizer, again, it depends on which literature you're looking at and which information you have at hand. The Pfizer was shown to really have poor immunity after, I think, about a week or 2 weeks post vaccination. I think it achieved an efficacy of about 52%, and really only after that second dose, 21 days later, that in fact the efficacy reached the levels that were reported at about 95%. However, I think there were some studies, and I'm sure they're ongoing studies, and this is really based around some sort of pragmatic approach around what numbers of vaccine doses do we have available. So if we want to achieve maximum coverage, can we delay the Pfizer vaccine second dose? And in fact, I think from the UK, it was shown that at least postponing greater than 3 months, you would still achieve a significant level of so-called immunity or efficacy. And I think that's probably some of the rationale, because again, remember, in South Africa, we're going to be getting tranches of vaccine, but we really want to achieve as widespread coverage, and so perhaps that pragmatic approach around delaying the second dose may well come into play and may be useful compared to just having the 21-day period for the second dose.
So let's take a couple of steps back, Professor. The origins of COVID-19. No doubt you've been hearing the talk, especially coming from the United States, with regards to the origins of COVID-19, a natural emergence or the lab escape hypotheses. Give us a sense, is there a history of viruses escaping from labs with high containment?
Again, I guess in the official annals, I am not aware of such escape. I think there's just been one such escape was the smallpox, for example, and that's the one that obvious case that I'm aware of. But I think, again, if there were other escapes, I think it's really going to be difficult for us to really obtain any official histories around that unless countries are transparent with regard to what the risks it posed to the populations around them. So I think that lab escape, especially under the biosafety containment levels that are in the different laboratories, and again, there are very few of these high-level containment facilities around the world. They're very strictly regulated, and therefore the chances of accidents occurring are really limited, or should be really limited. I know there have been various debates around the modifications of viruses, and I think there was some discussion around, for example, some of the influenza viruses and modifying those or recreating them in the laboratory. And again, that caused really public outrage and concern, and that really led to the discussions around how to manage containment. So my sense is that overall, one would get a sense that these are highly regulated, that the accidents should be minimal, if approaching zero.
Yeah.
I think the more conventional approach around zoonotic infections, I think, still holds water for us in many of our countries that understand some of these particular processes. Because of our encroachment around environments, destroying natural environments, our contact with animals that will have other viruses that we've never seen before, has increased. And it's not just a once-off event. Our understanding of these events is that it probably occurs several times. And in fact, it's that last step, if you like, that chance event where a virus has mutated, for example, that it actually gains a foothold. And very often, some of these viruses may well mutate and you may get a human infection, but human to human transmission may not occur because, again, the virus adaptation is not that successful. So it is likely that these SARS-CoV viruses have actually been, if you like, infecting us as humans, but not successfully. And I think that there have been some reports, I think was it Malaysia or Vietnam, where they've isolated other coronaviruses that have actually not been successful. Yeah. So I think we just need to bear in mind what are the risks behind a conspiracy around biocontainment, but we keep that in mind. It's important to investigate it thoroughly to eliminate that, but also bear in mind that we've had these zoonotic events all through the ages. In fact, it's thought that one of the great influenza pandemics in the 19th century was really a coronavirus, not an influenza virus. But we can't prove that. But those are the types of theories that we need to hold on to, and in fact, what the evidence certainly shows us.
Look, Prof, I don't have to tell you this, but just for the purpose or benefit of the audience, we don't know for sure where this comes from. So that's why investigations are continuing. There's a number of theories floating around, but no doubt we will bring you the facts right here on this channel on SABC News. And Prof, every time I have you on the program, I always say that I don't want you to comment on issues of politics as it relates to the pandemic. But what would it take for the scientific community to get to the bottom of this, to pinpoint exactly where and when this virus originated?
Yeah, so I think it's really around investigations. As you know, there's really ongoing investigations of other species, and in particular bats, for example. They harbor a high rate of viruses that we've never seen as human beings, and those are likely sources of being transmitted. And so, for example, I think the group in China, in fact, their particular laboratory is really well renowned for trying to investigate these particular, and in fact may have early identified this particular virus even before it became the virus that we see today in the pandemic. So I think it's really trying to look at the trail from the bats right on to the actual high-level facilities to investigate these, to look at the markets again, to look at the animals that were in that particular scenario, try and test and see whether or not those viruses are existent. It's a really difficult mission. In fact, in South Africa here, we have a BSL-4 and a program also trying to identify species of bats that may well harbor viruses that in time, we don't know when or how, will actually cross over to humans and ultimately may lead to a new pandemic. So these are ongoing investigations to really try and identify those particular possible zoonotic transmissions or potential zoonotic transmissions.
Right.
Yes.
So let's deal with the state of play currently with regards to vaccines, incentives for vaccines. I was just looking at some reports, especially in the United States. International reporting suggests that California has announced about $116.5 million in vaccine incentives as demands dip. More states turning to cash lotteries to boost vaccine rates. Do you think we're going to get to that point? What's the level of trust with regards to vaccines?
It's a complex area. In South Africa, I think we have about, depending on which survey you read and depending on how well those surveys are conducted, I think about 67% or thereabouts, but again, a range of about 50 to 67% of South Africans actually will have the vaccine. There's a group of people who may well take the vaccine, but those are the group that we need to target because they're saying, okay, I may take this vaccine, so there's a bit of hesitancy, but how do we, the rate of that vaccine program, if it comes nearer to them, they may well change their mind. And then there's going to be that set of individuals that will definitely not take the vaccine, either through religious or other ideas, conspiracy theories, for example, will hold on. So it's really that middle group, if you like, that we need to target. And targeting vaccines is really a complex matter. It's around race, it's around your political affiliation, it's around your gender, it's about your geographical location, it's about who you trust. So there are multiple levels in which campaigns have to be targeted. And again, you and I may be well be in an echo chamber and convince a specific demographic to take the vaccine, but perhaps there's a group of individuals who are highly educated who won't touch the vaccine. So how do you reach those individuals? How do you guide them to secure and honest and transparent sources of information for them to take up the vaccine, including branding, as you know, in the United States as well, as is here. People would say, I prefer Pfizer, I prefer, the other vaccine. And so that's how it goes. I think it's a complex issue. Incentives, again, I sometimes hesitate around incentives because they can become perverse. And so you may not want to reach that level, but that's possibly a personal opinion. I think it's really, South Africa has a well-developed, expanded program of immunization that has really been successful. I know it's been focused on children. I think we really need to build on those particular experiences. We've not had to use incentives to reach the level of vaccination that we've achieved. So I think we really need to build on that and to target appropriately and correctly to really achieve the levels of vaccination to reach at least some level of protection against severe infection, but also possibly to work towards herd immunity, which is the more difficult target to reach.
Another hour, but we've run out of time, but we do appreciate you, always instructive. Thank you very much indeed for coming on and shedding some light on some various complex issues. Be well. Good health to you and your family.
Thank you as well. You too. Safe bubble.
Take care.